Leading scientists have warned the continuous total disregard for COVID-19 protocols could undermine efforts being made to contain spread. Now, speaking to Israel Live, Dr. Yao Bidiakum and Dr. Peter Kwashi of the West African Center for Cell Biology of Infectious Pathogens at the University of Ghana observed, because Ghana's fatalities were on the low, the impression has been created that coronavirus was not a danger to public health, an impression they believe needs to be eroded.
This disease is different from many other pandemics or epidemics that you've seen in that it's very hidden. It only, a small fraction of people who are infected will present with symptoms serious enough to take them to the hospital. Majority of people will just take paracetamol or not feel anything at all. And so testing has been the bedrock. The WHO and actually the Ghana Health Service have also, and the president, His Excellency the President in his speeches have constantly talked about testing, tracing, isolating. The idea that the only way to really control the spread of this disease is by widespread testing. And so Africa has had a challenge in that, this virus is also difficult to test for. It's not cheap to test for. It's a virus, it's a respiratory virus, and typically respiratory viruses need to be detected by PCR.
As for less people being infected, I think even the numbers will show you that that's not true. The real issue here is, I think it's threefold. If you look at the positivity rate, the positivity rate has gone up. And in the past, we were able to test a lot at a high rate because we were pooling samples and having reagents and the like. Now, once your positivity rate goes above 8 to 10%, you can't pool samples anymore. You have to run one by one by one. So whereas the same reaction in the past, you could have done 10 samples, now you're doing one. So from the same reagents that you would have used to do 100,000 tests, you're now doing 10,000 tests. And I think that's why our rate of testing has dropped drastically. Now, what that translates to is if you're testing less people, you have more backlog. These people never get a result. And I think it's gotten to the point where if your sample is 3 weeks old, it potentially may be discarded. You'll never get a result. And in Dr. Bediako,
hold on. I like you to clarify that. You're saying that what? If your sample is 3 weeks old,
that is hearsay. But
no, it's actually, let me jump in. It's actually the official policy. I've seen it in an official policy document that they are prioritizing samples that are at least within 2 weeks because the discharge period is 14 days. So if Dr. Teti sends a sample and it comes back after 14 days, it's no use to him. So the official policy to deal with the backlog has actually been that they prioritize. But I think that now my understanding is the backlog has been cleared, so things are moving better. But
yeah.
Beyond 14 days, they won't test it.
So one thing we've noticed.
This is interesting.
One thing we've noticed, Dr. Bediako mentioned that we are screening mostly healthcare workers, but we're moving to the public pretty soon. But one thing we've noticed that there have been people who have taken a test, never got their results, and they have antibodies. And we've gotten a number of them. They never got a result back, which means that during their period of time waiting, and they weren't necessarily in government isolation, if they were not taking precautions themselves to self-isolate, these people were walking around thinking they were fine. And in most cases, these were asymptomatic people. We've seen that in health professionals. We've seen that in the public. So that's, I don't think that the fact that there's less burden at the centers is indicative of less spread. What it actually may mean, and that it might be a boon to us, is that we are not seeing people falling down dead as is happening in other countries. There are countries where they are refusing to address it, or even they are addressing it, but the spread is so much that people are literally dying on the streets and they are going around and picking them up. So this is the one thing that really is the silver lining that you can see in this.